Oh, but I think your notes will be all right. Hi, everyone. Thank you for joining us. And I'm going to, oh, thank you, Ruth. I was about to just kick your screen share off for a second. Thank you all for being patient as we sorted our, I was going to say technical issues, but it's not really all that big of an issue. We were just, presenter view is giving us hassle. Let's see. We have folks still just steadily filing in. Welcome. Quite a few names I recognize. Hi, everyone. It is like chilly and cold. It is in the 40s and rainy here in DC. I hope others are having a warmer day than I am. My feet have just been cold all day. All right. Looks like we've come to a trickle. Welcome, everyone. My name is Frank Hood. I'm the director of Hep B United and the associate director of policy and partnerships at the Hepatitis B Foundation. I am thrilled you're all here to take part in today's Be Informed session. Be Informed is a virtual hepatitis B education series that we put on every other month here at Hep B United. As I'm sure many of you know the process by now in this Zoom world, but I'll still go over it. This is a webinar, you all are on mute, but please do be active in the chat. Welcome to drop your introductions in the chat. And we do ask that you use the Q&A box for questions. We do use the end of our sessions for Q&A, and it very much drives much of this session. But if you put it in the box while the speakers are speaking, it gives us an opportunity to potentially answer it as we go, and then thus giving us a chance to get more things answered. Additionally, this session is recorded, and we will post the session on our Hep B United website, usually within, I'll say within a week. Usually we do it next day or within a couple days, but this is a holiday week, so I'm not sure how fast we'll get turned around. In case you've not been to a Hep B United event before, welcome. Hep B United is how we like to say, a coalition of coalition. We're a national coalition that is made up of state and local coalitions working to really reduce the health disparities associated with hepatitis B. And this can look like an organization focusing solely on hepatitis B or focusing on their community's overall health and recognizing that hepatitis B plays a larger impact in their specific community's health. And so we work with them to help bridge those gaps. And as you can see here, more than 50 local coalitions. I think we're missing just a couple of pins on there now, but we're quite spread out and always looking for more partners. So if you're based here in the US and working on hepatitis B in your community and aren't a part of our coalition, please reach out to me and we'll have a conversation. So this series is part of one of our capacity building programs. It's new this year. This is our 4th session. We host, the Hepatitis B Foundation hosts a technical echo with providers. And through that process, really found the power of echo and heard from public health advocates kind of outside of that clinical space, their desire to get some of this information about the more technical aspects of hepatitis B, but done in a way that is able to bring it to them, whether it is community health workers, advocates, or people living with the disease. So we brought together this program. It is the 3rd Tuesday of every other month at 3 p.m. Eastern. We shoot for it to be about 45 minutes, so you have a chance to check your email before your next meeting. And we really have been going through specific topics in an organized way. And when we have these conversations, we have a very didactic conversation and then bring in some case studies to really sort of show what was sort of just taught being used in action kind of right away. So today, I think everyone's losing their voice. So today, we're in the midst of the welcome. We're about to kick it over to our didactic speaker, and then we'll talk to our to hear from our case study speakers, and then we'll have a Q&A and open discussion. And for today, so our didactic session is on vaccinating the community, and we have Ruth Brogden from the Center for Asian Health at Cooperman-Barnabas Medical Center. I'm always excited for these sessions, but this one's a little bit, it feels a little bit like a cheat because we actually saw Ruth give part of this presentation for in a longer, bigger cohort, or a smaller cohort, longer presentation, and we're just like blown away by it. And we're like, can you please, like, can you go and share this wealth with more folks? So here she is. And then we're also thrilled to be joined by Angeline Nguyen and Jennifer Galdamez from HBIDC here locally in my area, who will talk about their work in the community later on. So, oh, yes. And then just while I have this pulled up, so I don't necessarily have to pull it up later, and I will flag this again at the end, but as I said, this is every other month, second Tuesday. So January 16th is, or sorry, third Tuesday. So January 16th is the third Tuesday of January, and we'll be talking about hepatitis B and hepatitis Delta in the harm reduction space, bringing on a colleague of mine, Beatrice Zovich, from our Philadelphia office to talk about a study and some interviews that she and her colleagues have been doing in that space. So that we just got that sorted today. So the registration isn't live quite yet, but it will be sent around along with the link to this recording to all of you who registered. So with that, I'm going to stop my sharing and stop my talking and turn it over to Ruth, who is the star of today's show. Thank you, Ruth.
Thank you. Okay, so
all right.
Frank, just want to make sure you guys can see the screen, correct?
Yes, and okay. To those of you joining us, we're having the minor technical issue we're having is that anytime Ruth tries to put this into any sort of mode other than this, it kicks back to this or just doesn't show. So she's going to be presenting from this view, and if she peeks at her notes underneath it, it's okay because this is not a test.
Great, thank you. I do appreciate the flexibility that way. And thank you, Hep B United, for having me. Thank you all of you for joining us today. I know that we are all working on a full work week workload on a very abbreviated week. So appreciate your time in joining today, where I'd like to share, as Frank mentioned, I spoke about screening efforts at our organization in New Jersey. And today I'm going to shift gears a little bit and concentrate a little bit more on improving our hepatitis vaccination in our community and also in the clinical setting here in New Jersey. Okay. There we go. Okay. So just as an overview today, I'm just going to give you a little bit of a background on the organization and the location in which I work. Our approaches in improving hepatitis B vaccination from two arms, from the community approach as well as the clinical approach. A new hepatitis B immunization initiative that we started at RWJ Barnabas Health, that's my organization here in New Jersey, in the beginning of 2023. And then in the efforts of streamlining hepatitis B vaccination processes, particularly in the clinical setting, I want to just show you some of our EMR processes. Okay, so as a background, as I mentioned, I come from Cooperman-Barnabas Medical Center, which is a close to 600-bed suburban community hospital in Livingston, New Jersey. It is part of the RWJ Barnabas Healthcare System in New Jersey, which is one of 12 hospitals. It is known to be the largest healthcare system in New Jersey. New Jersey is a small but very mighty state when it comes to diversity. We have the fourth largest Asian population of all the states in the United States, and also 1/3 of our population is foreign born. So we know that gives us a high population that could be at high risk for hepatitis B. But it's sad to see that only 35% of our New Jersey residents do know about their hepatitis status. The primary care clinic that I work out of is the Center for Asian Health. And Center for Asian Health is a primary care practice which was launched in 2013 to reach the growing Asian American population in New Jersey, and to do that by providing culturally sensitive and appropriate care with bilingual providers, staff, such as patient service representatives that meet you at the front desk, and also even navigators that will lead you to care from the community to the clinic. And as a primary care practice, our disease focus is in diabetes and cancer prevention. So, cancer is always that hot word, right? You talk cancer and you get people's attention. So we, in particular, when it comes to hepatitis B, focus on liver cancer and the growing rates of liver cancer, and how hepatitis B is your key tool in preventing liver cancer. And we know that we have those tools not only to address cancer, but the epidemic as a whole by prevention strategies, different diagnostics, hepatitis B vaccines, and also our treatments. Again, the majority of people living with hepatitis B do not know that they are diagnosed yet. And we know that to get towards hepatitis B elimination, with our goal being 2030, we need to, adopt innovative approaches. The couple of different approaches that we've employed is a community-based outreach and screening. We've scaled up testing and linkage to care at our hospital, and I'll talk a little bit about that. And we've also brought on a new novel approach in trying to increase patient and provider vaccine education, and that will be the focus of my talk today. So in 2022, we're all familiar with the CDC update to that recommended universal vaccination for all adults 19 to 59 years of age, despite their risks. And those who are over 60 with risk factors, they were recommended to also be vaccinated. We're all very familiar with the 3-dose Engerix, but there is a new 2-dose option that's available, the Heplisav, which reduces those 3 doses that need to be administered over 6 months to 2 doses over 1 month. And we see that by reducing those number of doses and in the time period, we have a higher vaccine completion rate. We also have a higher seroprotection rate with the 3-dose from the 2-dose versus the 3-dose. So with the 2-dose, we saw 90 to 95% versus a 75 to 81%. There were studies done in subpopulations, and those with HIV that had the 2-dose administered, they had an 80 to 93% seropositivity. And those patients that were on hemodialysis that had 4 doses, their rate was as high as 89%. There is a new 3 antigen dose, PreHevbrio, which targets the 3 hepatitis B surface antigens. And there is also a high seroprotection rate here between 91 to 99%. Although it is 3 doses, we do see that immunogenicity developing sooner right after the 2nd dose. And in 2023, the CDC also recommended universal screening, and that is for anyone over 18 years of age at least once in their lifetime, or if anyone would request it. It is recommended to do the standard 3-test panel for surface antigen, surface antibody, and core antibody. What was unchanged with these recommendations were that all women who were pregnant were to be screened and vaccinated regardless of screened regardless of their vaccination status or history of being tested previously in another pregnancy. Also, screening is recommended for anyone with a history of risk, all ages. and also those patients that are susceptible with ongoing risk. And it was also expanded to include our incarcerated people and people with a history of a sexually transmitted infection or multiple sex partners, and also those living with hepatitis C. So I want to talk a little bit about now vaccination and our efforts to increase our vaccination rates through two arms, through the community, through the Center for Asian Health, and through our clinical reach by using and leveraging the resources as being part of the Cooperman-Barnabas Medical Center. As I mentioned, Center for Asian Health has a very strong tie to the Asian community. We're able to partner with a lot of Asian community groups. We can reach them, and by reaching them, we're able to provide education, we're able to provide screening. We advertise in ethnic media print. We also utilize funding through private grants as well as government grants. We've had grants through the CDC, through the New Jersey Department of Health, private grants through Hepatitis B United, industry private grants, Gilead Sciences, to help promote reaching the community in terms of education, screening, and linkage to care. And those activities we have focused, as I said, through the community, through certain events that we've really harnessed on to push the message through, as in our Chinese Wellness Day. I'll talk a little bit about that. In May, Hepatitis Testing Day, and in July, World Hepatitis Day, all with the goals of navigating our community members back to our primary care practice at the Center for Asian Health. And then when it comes to utilizing the extensive medical resources that we have at Cooperman-Barnabas Medical Center, it's not only those medical resources, but also the resources that as a hospital care system that we can use in terms of reaching the public, information sharing, and those different disciplines. And I'll talk a little bit about that. And I'll go into a little bit about our services at the primary care level, the hospital level. And then I'm going to spend the bulk of the time at the end talking about a initiative, a new hepatitis B vaccination initiative with the medical group. So with partnering with the community groups, we have a dedicated community liaison who reaches out to our different Asian American community groups. And it can be something as simple and as casual as just a Lunar New Year social event to go out and meet them. But what that does is that gives the opportunity to make the connection and build trust. We found that that was very important when you go out into the communities, building trust, so that when you want to go next and start talking about health issues and health events and the importance of screening and cancer, you now have an engaged group that's interested. And so then we've been invited to come back for certain health fairs that they may have been holding, and then also come back and actually hold a screening event at their fairs. We have also co-partnered with them with different webinars, and you can see that flyer in the middle in a bilingual translation there. As I mentioned, we reach the community through ethnic media print as well. This increases and enhances the public awareness of hepatitis B. We're educating them about the disease, we're encouraging them to be screened, and we're giving them information about our clinics so that they can be linked back to care. We've used different approaches in the advertisements in the newspapers. We've had QR codes where the reader can scan the QR code and get more information about a particular health initiative. We've put raffles and surveys in our print media so people can, a little bit more interactive, and they feel like it's an incentive for them to get more information about our program. And this is just some pictures of our different and various education and screening events. As I mentioned, Chinese Wellness Day is one of our big events that we have around midsummer, I would say. It's a large comprehensive health fair dedicated to the Asian American community, but of course anyone is welcome. We utilize our medical providers from the healthcare system to come in and provide health talks, which is always a big draw. They also come in and provide one-on-one consultations for patients who want to come in and talk. And then we offer free screening. So you see right there in the middle of the screen, we have our hepatitis screening booth set up for one of the events. And that event was actually 2021, which was post-COVID. So we had to still have the event outside. But a lot of events, as you can see with our team and our flyer there for World Hepatitis Day that we use to get the message out. So it's important to note, though, that when we go out into the community and we do screen patients, we really ensure that we are linking our patients back to care. So when we do hepatitis B screening out in the community, we do the 3-panel where we're able to determine if a patient is susceptible. So as we're focusing on vaccination today, I just want to share that once we get those results back from the lab, our medical director reviews those results, and then our community liaison patient navigator makes sure that each patient gets a letter back to them regarding their results. This particular letter that you're looking here is an example of a letter in terms of someone who's susceptible and would need the vaccination. We know that with these particular letters versus a positive, someone who's screening positive, there's a little bit more of a dialogue that needs to take place. So our community liaison will call the patient and explain to them exactly what, being susceptible means and, needing the vaccination and why it's important to get the vaccination. And what I highlighted here on the letter was we took this as an opportunity to educate the patient on the 3-dose versus the 2-dose. And also we impress upon to them that we do offer that 2-dose to hopefully make the decision a little bit easier for them. And in terms of the clinical arm of our approach with this, as I mentioned, I am part Cooperman-Barnabas Medical Center is part of RWJ Barnabas Health. And with that, in addition to obviously clinical care, medical care, it provides just extensive resources in terms of doing public health outreach. RWJ Barnabas Health has a service area covering 9 counties with 5 million people, and that is reflective of about half of the population in the state of New Jersey. It's also important to note that our healthcare system is New Jersey's largest private employer with more than 37,000 employees. And as you see in this talk, as I get into it, our employees are also viewed as the patient. In terms of the designing a program, whether it be screening or linkage to care and launching it, again, we have that clinical team and staff that is there, but there's so many other disciplines that come into play that help us in designing a program and launching it. We have resources in terms of marketing and design, in terms of, flyers and web designs, publicity. We partner with our community health team. We partner with the social impact and community investment team, our information services, library, media services. IT is a big part of our automated hepatitis screening that I'll get into. We also like to leverage our employee platforms, which is basically our intranet and the apps that our employees use to get information to them, because as I said, we see them as a patient in this initiative that I'm going to talk a little bit more about with you. And also we have very good and strong relationships with our vaccine account managers, in particular Dynavax, that I'm going to speak about a little bit later. So in terms of our primary care hepatitis services, speaking specifically about the Center for Asian Health, we do hepatitis screening as part of our wellness care. And sadly, we know that a lot of primary care practices don't necessarily always do that. We have an ambulatory pharmacist on staff that provides consultation and assists patients with medication. They assist them also with their pre-authorization in terms of the medication and getting it delivered to them. We have the navigator that makes sure that a patient gets all the proper blood work and any type of radiology or imaging scheduling done in the time frame that they need to get it done. We offer telehealth as a way to keep patients on schedule. And also just by our link with the community and the other, quote, public health activities that we have, those patients that come to our primary care practice also are linked to patient-focused activities. They can become involved in different focus groups. They are given information about free screenings when we have them out in the community, and also webinars that we hold. They then become privy to that. And in terms of the hospital, what we have done is we have scaled up hepatitis B and hepatitis C screening at the hospital level by launching a automated screening program within our EMR. And this identifies those people. The focus of this program is to identify people living with hepatitis B and C. And I say that because the panel that is done at the hospital level, it's not a panel. It's just surface antigen for hepatitis B. So we're focusing on identifying positive patients and linking them to care. However, by identifying hepatitis B positive patients, especially those who did not know their status, you can see that they're very engaged, and that is an opportunity to reach household contacts. Interestingly enough, of those patients that have been identified as positively screened, about half of them did not know their status. So they're very engaged. They want to get into treatment. A lot of the feedback has been, wow, if you didn't do this, I would have never known I was Hep B positive. And when we get them into care and we educate them, they then in turn are able to talk to their loved ones and their household contacts, which then link them to screening, which provides, an opportunity for finding, possible household contacts that are susceptible and may need the vaccination. Also, by doing this program, it just gives us an opportunity, a platform, a forum to provide education to our providers. We either through just by launching the program and then explaining the program to providers, grand rounds, different type of emails, they get educated. And then of course, we disseminate a lot of our findings through different professional meetings. And real quick, this is just how the automated protocol looks like. Basically, anyone who comes into our emergency department who's 18 years of age is having blood work ordered, because we're just adding this panel or tests, I should say, on top of the blood work. They get tested as long as they meet certain criteria. So in particular for hepatitis B, if you were born to a race of a hepatitis B endemic country, a surface antigen order automatically fires and that patient will be tested. And then down the line, identified, linked to care, and then linked to treatment at our primary care practice. And we also do tests for hepatitis C as well. We have also included a urine and serum toxicology test, as well as a peer recovery order, as another indicator to also be tested for hepatitis B. Okay, so I wanted to just talk to you about our fairly new immunization initiative that we started earlier this year in 2023. And our initiative was, we wanted to focus on reaching and educating providers in our healthcare system and reaching and educating patients. And under patients, there's really two arms. And I'll get into that, I'll tease that out a little bit. So first, in terms of reaching our providers, what we did was in January, we had worked with our ambulatory pharmacy team in putting out a SBAR communication. And for those who may not know, it's just a very concise way of providing information in terms of background. You're providing the situation, the background, the assessment, and the recommendation. So in terms of the SBAR, we wanted to impress upon our providers that vaccination is a key prevention strategy in terms of preventing liver cancer, and that liver cancer was on the rise, and chronic hepatitis B infection is a big motivating risk factor for that. That those patients that do have the Hep B 3-dose series really do not complete those dose series as much as those that may do a 2-dose series. And we get into that a little bit. And then also the immunization recommendation that I spoke of earlier, the FDA approval, which had of the 2-dose vaccination, as well as that at RWJBH, our advisory subcommittee did approve Heplisab, the 2-dose series, as the preferred hepatitis B vaccine. And also, last but not least, provided a cost analysis to our providers, and stating that there is a cost savings with the 2-shot series, that with 3 shots, it cost $153,000 per quality adjusted life year gained, versus with the 2 shots, it's only $122,000. And again, just impressing upon them that in a study of about 11,000 patients, with the 2-dose series, close to 61% patients did complete it, versus 32% that completed it with the 3-dose. So all points to, hammer back to our providers the importance of vaccination, and that we have this 2-dose and that we have it at RWJBH. So the SBAR, the recommendation part of it, ending with the combined medical group recommends the universal hepatitis B vaccination for our patients 18 to 59 with the 2-dose Heplisab B as the preferred vaccine. The SBAR is an example of that is on the left. That went out to all our medical group providers. And we also attached some visual aids for them so that they could print it out in their office. And that's what you see on the right here. And then, as I mentioned, in terms of patients, so this newsletter went out to the medical group patient newsletter listserv. And again, just basically hitting more the same points that I had mentioned from the SBAR, a little more lay language for the patients, impressing upon vaccination, the 2-dose, and that you can get it at our medical group. Some other ways that we wanted to also reach patients, or I should say looked at patients, was we looked at our own workforce staff, our healthcare workers, as really key patients that also needed to hear this message. Healthcare workers at higher risk of contracting hepatitis B through a needle stick or other modes of exposure. So we used our different intranets, different messaging that we have within our RWJBH platforms to reach our healthcare workers. So on the left, you see like a employee news and announcements letter where we were using Liver Cancer Awareness Month as a way to get the message out. On the right is our medical director, Dr. Sue Wong, who did a couple of YouTube videos that were then posted on our intranet site on just, first of all the different hepatitis and preventing, and then there was one specifically on vaccination. And again, just some other examples of it. This was just recently a screenshot from our intranet site called The Bridge, and it was a nice graphic of Liver Cancer Awareness Month, which then if you clicked on it, brought it to more detailed newsletter, which is on the right. So these efforts we see have paid off, and this was information through the great relationship that we have with our Dynavax manager representative account manager, that we have a relationship with, shared with us. And as I said, the SBAR and the different communications that went out, it started in January of 2023. And you can see that on the left there, for the first quarter, it was a combined 375 doses were ordered of Heplisav. And if you go to Q4, and in Q4 only reflects October, actually, we're at 345. So we still got, November and December, we're definitely going to surpass it. You can even see the growth just going from Q2 to Q3. Our account manager noted that this was not even all of the medical group providers, because some of them were a little bit slow to switch from Engerix to Heplisav. So we definitely believe that our approach in trying to reach the providers through our different, communications had some uptake here. And lastly, I just want to get into streamlining processes in terms of at the clinical level. And we think about the EMR as a way to do that. As I mentioned with the automated hepatitis testing in the emergency department, we use the EMR as a way to just push out automated orders for testing. And so thinking about that in terms of the EMR, in terms of vaccination, unfortunately, we don't have that clear, streamlined, type of process right now. What I want to show here is a couple of screenshots from Epic, which is the EMR that we use. And the top screen on the left there gives you a screenshot of what, vaccinations that a patient has received. And this one in particular, what's the issue here is that when you see hepatitis B vaccine aged out, Epic is it's not reflecting the new guidelines for 18 and above. So it's reflecting pediatric guidelines. So it says that the patient is aged out of it. But if it were to, incorporate those new guidelines and, have it recommended, what would happen is, like on the second screen, this is what a doctor would see when they would log in, is on the left-hand side, that green column there, that's considered our dashboard. And that's like on every part of the screen when they're in a patient's chart, they would see that part that's circled that says care gap. And where you see, Medicare annual visit, glaucoma screening, there's some other vaccines there, COVID-19, hepatitis B would be there. So this is definitely an opportunity for improvement in terms of the EMR and making those guidelines applicable to the EMR. So this is an example of what they may see in terms of they'd have to look in different screens and find out what current immunizations are available for that particular patient. And lastly, this is another screen. Again, it's a little bit of a navigation for the provider to go and find out what screens were given at other sites, what screens were administered, finding it. And unfortunately, it's a little bit of a looking, the provider has to be active and looking at it. And what we're looking for is an EMR prompt of some sort, so that the provider gets that prompt to say, hey, vaccine recommended, they're due, and then can order the vaccine. So just in summary, I wanted to share with you some, the multi-pronged different approach that we've used in reaching providers and patients through our community and clinical partnerships. Again, patients being not just our patients that are being seen at the clinic, but also our healthcare workforce, which is an important patient population. And we also impress upon our workforce that not only for them, but also when they are educating, we're educating them, and in turn, the cascade is for them to educate their patients as well. We have been very successful with our community outreach and partnerships, as well as utilizing our hospital and clinical resources in reaching these two populations, and also have been able to take advantage of the different opportunities that come out of being part of the healthcare system and the different relationships that we have, like as I mentioned, the account manager with our vaccination industry. As you can see, it's a multi-prong approach that really does take re-engaging our target audience. As we said, we've been doing this since January, as recent as October with our current communication. We have identified that there could be challenges in terms of program resources. Some of our staff is grant funded, and because at the hospital and clinical level, the focus is on clinical care and having those personnel that are taking more of a public health and kind of programmatic approach is not always a part of the personnel. And so to drive this is important, and to make those partnerships within the organizations to drive this is important as well. You do see the limitations that we had with our EMR and immunization screens, and that definitely is a challenge, but also an opportunity for us to work with EPIC and other analysts to see if that can be changed. Finally, our next steps are, as I mentioned, the EMR prompts for clinicians, as well as an opportunity to collaborate with other RWJ corporate care sites. And that's just a fancy word for saying employee health, to increase education and healthcare worker vaccination in our RWJ-Barnabas Health community. We have actually identified one site. We have started to work with them. They have shared with us that of their workforce that have attended their corporate care site, only 30% have completed their hepatitis B 3-dose vaccination series. So we're going to focus on them and use them as a sort of like a pilot location and see how we can then expand this to other corporate care sites. And I just want to thank you all again for joining. I need to thank also the multidisciplinary team of both Cooperman-Barnabas Medical Center and RWJ-Barnabas Health. As you can see, it's a large team concerted effort in terms of increasing our vaccination in our community. Thank you.
Thank you, Ruth. That was super informative. I'm going to move us right along to Angeline and Jennifer, so we still have a few minutes for Q&A at the end. And again, please, folks, put your Q&A in the Q&A box at the bottom. But yeah, so Angeline and Jennifer are with HBI DC here in the Washington, DC region, and I will turn it over to you two to introduce yourself and just give us kind of a quick rundown of your work in the community and kind of how what you've just heard Ruth say gets kind of applied in your work, so our audience can kind of have that point driven home for us.
Sure. Thank you so much for having us. My name's Angeline Nguyen, and I'm a nurse and project manager here at HBI. And my colleague, Jennifer Galdamez, is a CHW lead, and she also does linkage to vaccines. So what we do is like a really small scale of what Ruth does. We're a community-based nonprofit organization. We utilize CHWs, community health workers in the community, to go and outreach and do education and screening for hepatitis B. So then when we get the results, if they're positive, then I will call them, provide education and linkage to care. The barrier with our clients is most of them are immigrants. They don't have insurance, or they're underinsured. So we have networked with the NIH, University of Maryland, Johns Hopkins, to take our clients who are positive and don't have insurance. So for hepatitis B, they're taken care of. And then when Jennifer is processing the results, she can tell you a little bit of how she provides linkage to vaccinations for those who need vaccinations. So Jennifer, you can go ahead and introduce yourself.
Yeah, hi, my name is Jennifer Galdamez. I'm with the linkage to care, and also with the health screening for the HPI. Usually when they come back with the negative, they need the vaccinations, and then I send them the letter and link them to the provider. We have some provider, they do the vaccine, but with less cost for the patient with no insurance. They can pay only like for the 2 doses, they pay only $50 for the 2 doses, and then they can get the 2 doses. For the 3 doses, $25 for each. That means $75 they can get it. And that is the processing we do with the patient. We link the patient to getting vaccination, or some client, they have not like we used to give the patient some free vaccine when we give him some funding for that, and we provide for fund. We call the patient back for one of the locations we provide for free, and then we follow up for that. And now we don't have no funding like that. We refer the client out, or some client, they have the insurance. We make the referral for them to go to like CVS, Giant, any provider they want to go. That is the processing we do for the linkage to care with the client, they need the vaccine. Yeah. You have any question for that, so we can?
Yeah, I would say, are there oh yeah, and I got Ruth unmuted as well. I was like, do we have any questions from the audience? I don't see any. So my question then is, do you have a sense or like a percentage of your follow-up connections for folks who don't get a phone call versus the one like who just come and kind of show up on their own versus the ones who you do engage with that follow-up phone call? Like, have you had numbers that sort of measure how successful that follow-up program is?
Yeah, usually I do the link after call, the follow up after the link to care, because I call them for the people they get vaccination, because I have the list and I have the records for the client. They always get the full dose, and some clients sometimes they come for the first dose and they don't come back for the second dose, and then I will contact them back and to see like what the reason they don't come for the second dose, or but they miss it, or they don't have, or they move out of the state, or some of the reasons, and then I getting the record back. And then when they not, and then I will, or they say, oh yeah, because I missed it, or something like, oh, I've been sick, so I can able to get a vaccine, and then I link them back to get the vaccinations again.
So I've actually, this is a question for both Ruth. I have a question. I kind of am interested to see how it is answered from either side. So HBIDC is talking or mentioning a scenario in which you're needing to find providers that can provide this sort of treatment for an uninsured population. I know that you all are actually a mini grant recipient this year, working on that particular issue of finding providers who do this work. So you're an organization, you find a provider like Ruth, you do outreach. What does that conversation look like from your end? And then Ruth, like, how do you all handle when you have an organization like HBI kind of reaching out to you all, being like, hey, you're all the biggest, healthcare provider in the area. Can you help our tiny little org out? We're doing great work. So I'll let HBI go first, and then would love to hear from Ruth as well.
So well, that's our executive director. That's her goal this year, is to find, more providers. But in the past, when we do health fairs, we have, community members say, like, okay, can you come over to our church and do outreach and screening? And that's how we network. And then those community members, they're doctors, and they're like, you know what, we have a clinic, let's partner. So we'll do the screening. And then she's like, I will take, those positive patients, because we have a Dr. Laura, she's based in Maryland. So when we go to Maryland and we have, an event, she'll come out to do some, education and look over, blood pressure or blood sugar, whatever that is. And then once we find positives, we're able to link her that area, at least to her clinic. In Virginia, it's a little bit more difficult. We don't have anyone here yet. We used to, but unfortunately, Dr. Tran, he passed away. So we're trying to fill those really big shoes. But we're able to send them at least to the NIH, because they had made an agreement that they will accept any of our patients who's willing to go and follow, their protocols. And then we also work with Dr. Tang, and I think we were doing a lot of screenings in the Mongolian population for we have, you know, a city in Arlington has a huge population of Mongolians, and we were finding so many positives, Hep B and C. And, you know, Dr. Tang was like, you know what, I have a study, you can send them over here as well. So, you know, we try to spread them out where we can for linkages. But, you know, mostly when our work in the community kind of attracts other providers who are willing to come out and say, you know, like, what can I do to help? Or like, can you treat for Hep B? We understand if you can't do it for free, but at least for a reduced cost. And then we can try to help find resources to get insurance for these clients in the long term, you know, end.
Awesome. Thank you. And now I'm expecting Ruth to be like, yeah, no one ever has to ask us for help, right? We always anticipate and just show up and willing to partner. Ruth, how
Yeah,
old are
because
you?
now we're getting more providers engaged to help with HPI, you know, like take the patient from HPI for overall health, even like for Hep B, for Hep C, or for any kind of, because we have more provider right now. We're engaged with different group in DC, Maryland, Virginia, the 3 different states right now.
Yeah, and then the healthcare systems want to talk to one another very well there. Being from this area for the last 15 years, yeah, it is not. It's a bit of a mess when you're trying to get healthcare across state lines right here. Ruth, how old do you work with community partners in this way?
So, you know, it's I think sometimes just a misunderstanding that we're a hospital. The hospital is just there for patients to come to. You come to us. But quite honestly, hospitals are an anchor in the community, and we need to be out in the community. We need to meet patients where they are at. And so we are unique, and I pride myself in saying that Center for Haitian Health is unique in that we have this community aspect of our work where we go out into the community and make that effort. But we rely on that relationship of, we've tried it both ways. Making those cold calls to a community group, no matter how, quote, big or small. And to me, all of them are big because you're the community. And we've tried the other way, or we've had it fortunate happen where they've come to us. I much like the latter, quite honestly, because it's very hard making cold calls. And when they come to us and we're like, yes, we want to definitely help you. It's such a great mutual relationship. They're showing us what their need is. They're showing us what their population is. We are bringing resources, and it's just a nice mutual relationship to work together. So, and by the way, the quote healthcare system, community health team, social impact and community, they love that. They love that we have done part of the work for them, for lack of better words. So it's a great opportunity when community groups reach out to us, and that's part of why we do so much advertising. Like if we get out there and you know we're there, then hopefully, if we don't know where you are, hopefully you know where we are.
Awesome. Well, we are at just about 5 minutes till, and we always try to end a little bit early. Thank you to all 3 of our speakers today. This was very, very illuminating. I just feel like that was a great place to end on, because what I heard was that folks should just ask they should ask for help, because it sounds like folks are very excited to give it. And Ruth would much rather be asked for help than have to call a stranger and be like, can I help you? Which I can get. I mean, I understand. I'd much rather have someone call me out of the blue than have to call someone out of the blue. So the request, I said the recording will be sent to everyone who is registered. We will also be posting it on our Hep B United website. And when this webinar closes out, you should be presented with 4 quick survey questions. I ask that you please fill those out. That is our post session evaluation that helps us determine how to make these sessions better or more streamlined in the future. But again, just a big round of applause to our RWJ, Barnabas Health, and HVIDC speakers today. And I will be curious to see what folks come back with in the future, saying like, I heard this on that session, and then we did this. So maybe we'll have to do a follow-up sometime next year on all of our programs and how people were impacted. So all right. Thank you all.
Thank you.
Thank you. Happy Thanksgiving.
Thank
Happy
you.
Thanksgiving.
Thank you.